On the other side of the healthcare debate, a Democrat who supports President Obama's plan, Senator Jeff Merkley from Oregon. And Senator, I was looking at your bio when you were a young guy, just getting your feet wet in politics. You worked in the Congressional Budget Office, and
very true.
Yeah, and so I thought, well, who better to ask than a guy who's been there? Why did the CBO come out and say the costs are going to go up, and the president is not acknowledging that? Why?
Yes, the point that the head of CBO was making is that there are many elements that address cost, but they're not things that CBO feels qualified to score. For example, prevention, disease management, the fact that folks won't be going to the emergency room and will be inside of the system already, the pricing structures that emulate the Mayo Clinic. All of these factors, they don't really know in a concrete way. It doesn't fit into the existing models. They can't really put a price on it, and therefore don't feel qualified to score it. And that's just one of the challenges we have to live with. But we're going to be spending $40 trillion over the next 10 years on healthcare, and changing these practices, including an idea that comes from firms like Pitney Bowe and Safeway, where they use healthy choice incentives to really get people to drive down the cost curve. All these things are in the bill. They're very important.
And all of that is great, Senator Merkley, but at the same time, the critics of the House plan in particular that the Democrats have put through is that, from Nancy Pelosi, is that this is basically just another massive entitlement program that's going to be government run, like Medicare and Medicaid, which is, as you know, the costs have ballooned. And they're saying basically, look, you're going to have another Medicare, Medicaid disaster on your hands with this government-run public option. So how do you respond to your critics on that?
Well, I can tell you, I've been holding town halls all over Oregon, talking to folks from the right to the left, conservative parts of the state, and they want the full range of choices. They don't want to be told that they have to choose a private insurance company, often when there's only one in the existing market. They like to have the full range. We have a public option that was put together in Oregon on workers' compensation when we had a completely dysfunctional workers' comp system 2 decades ago. So we've seen it work in our state, that the competition has increased efficiency and driven down costs. This is about citizen choice, and we shouldn't be talking about taking away choices from our citizens who want to exercise those different directions.
Well, but Senator, you also have more than 12% unemployment in the state of Oregon. Senator Jeff Merkley from Oregon, we are going to have to leave it there. We're out of time. Thank you, sir, for appearing on Fox Business.
Thanks, Senator.